Hi everyone, my name's Dr. Eamon Hickey. I'm one of the Junior Clinical Fellows in Barnsley Emergency Department. Together with Dr. Rebecca Graspy and Professor Suzanne Mason, we've been looking at analysing the referrals from general practices in the Barnsley area to the Emergency Department, ideally looking to evaluate the effect of changes to the practice in ED and GP and the referral systems used over the course of the COVID-19 pandemic. Overall, we were going to be looking at the number of patients that had been referred into the department, as well as the markers of acuity being quite a broad term, quite difficult to define. So we used a number of different data points for it, including whether ambulance transport was required, what the diagnosis was after assessment by an ED clinician, the number of avoidable attendances, avoidable attendance being defined as something where investigations and management done in ED can also be done in outpatient settings, and these include things like urinalysis, pregnancy tests, swabs, TTO prescriptions and written advice sheets, and excludes things like ECGs and bloods where the results come back within an hour that aren't usually universally available in those outpatient settings. So we retrieved data from all ED attendances in April and May of 2019, 20 and 2021. Those 2 months were partly chosen to get a representative idea of what the department state was like shortly after lockdown was introduced, and then to compare that to a decent amount of time before the COVID-19 pandemic. We then extracted those that were marked as a referral from GP or out-of-hours services and compared those data points to overall ED attendances in that same time period. First, we can see the number and proportion of referrals from GP practices increasing over that 2-year period, going from just under 1,000 in 2019 to over 1,700 in 2021, and with a rise in the proportion of overall attendances in that time frame as well, going from 5.7% to 10.3% of all ED attendances coming from general practice. Next, these couple of slides are a little bit cramped, sorry about that. The 8-slide limit meant I had to move things around a little bit, but we're first looking at the attendances that required ambulance transport, and in overall attendances that stayed roughly the same at about 35% from 2019 to 2021, but fell from 14.8% of GP referrals to 6.6% in 2021, so quite a major drop in those requiring ambulance transport. Next, we looked at a number of key diagnoses. So previous work in the department on referrals from the 111 service identified some key things that required treatment in the ED or stabilising on their way to admission to further treatment as part of a direct specialty. And those things would include ACS, COPD exacerbations, sepsis, appendicitis and stroke, were the 5 key ones looked at. So the total number of those key diagnoses was roughly the same. There was quite a bit of variation in some, notably in COPD dropping off quite a bit, as well as in 2020 quite a significant drop in just the number of people that turned up in ED. I'm sure we're all aware of people who didn't come to hospital when they probably should have. But looking at those numbers as a proportion of overall attendances and overall referrals to the department, there was a fall in those number of key diagnoses from 9.5% to about 4.7% in that time period of those referred from GP practices, as well as a rise in those who were coded as no abnormality detected or no clinical concern. So next we looked at the percentage of patients that were admitted or discharged, finding an increase from 56% to 70% of referrals from GP practices that were discharged from the ED, so a fall in admission rates, with a small but notable increase in overall discharges as well. So notably with the numbers there, the number of patients that were admitted from GP, there was an increase from about 428 to about 508 that were admitted after referral, but there was a much larger increase in those that were discharged from ED, from about 559 to 1,258, so quite a significant difference there. And then we also looked at the number of patients that reattended within 7 days of being discharged from the department, and there was a small rise in GP referrals that were discharged and came back within 7 days that will hopefully be looked more into when we do the statistical work further down the line. As I mentioned, avoidable attendances are those where investigations or management can be carried out at urgent treatment centres or primary care facilities, such as urinalysis, etc. And we can see that there's a difference from 2019 to 2021 in both GP referrals and all attendances, and quite large rises in both groups. Notably, with avoidable attendances from GP referrals, there is that more than doubling in that 2-year time period, in a time where overall referrals from GP has almost doubled in total. So of course, as in all cases, there's a number of limitations here. It's a single data resource from Barnsley Emergency Department's electronic system that requires declaration from either the patient or the paramedic crew if they've been referred from a primary care practitioner. And we can't discern from that information if they've been sent in by a medical practitioner, by reception staff, by an automated messaging service. There's no way of collecting that data from what we had. And in other difficulties of measuring, we had to use indirect measures of acuity. We looked at using presenting complaint in triage category, but there was such high variability as presenting complaint being manually entered by text, and triage category can vary massively from day to day in what gets triaged as what, with a high number of empty entries in both. Finally, this is an incomplete study without statistical analysis, so there were a number of areas where that would improve interpretation. So, in summary, from the overall data that we've looked at, it appears that compared to pre-pandemic levels, the number of GP referrals to the ED has increased quite drastically, while the acuity of the referrals appears to have fallen. And this, of course, results in extra workload of patients who don't require emergency treatment or admission to hospital. The reason that we did this study and why we think it's important is that there is work to be done on streamlining the referral system and exploring other avenues for referral, such as SDEX, such as easier direct specialty admissions and increased provision of urgent treatment centres, which Barnsley currently doesn't have. So the next steps that we're currently engaging in are to get in touch with GP practices, to engage with them to improve the referral system and the communication between the two areas. So thank you very much for your time. I look forward to seeing you all in person, and please direct any inquiries that you have to my email address below. I'll do my best to answer as best I can. Thanks very much.